We appreciate everyone joining today. Now, let me turn it over to you, Brad.
Thank you so much, Heather. It's wonderful to be with everyone this afternoon, and I really appreciate your great introduction, Heather. Smart employers have determined that the mental health of their employees has been significantly impacted by COVID. And the fact that you're on this call today shows that you want to become knowledgeable about this and you really want to help your team members. So I just want to commend everyone for taking time out of your busy schedules today to do that. We're going to cover a number of topics. I'm going to start off with the value proposition for quality mental health care. I know many of your HR professionals on this call, and typically the first question the finance person is going to ask is, well, show me the bottom line. So I'm going to show you the bottom line first. We're going to talk about COVID and its impact on mental health with some specific numbers for specific conditions. We're then going to talk about what other employers have been doing given the situation that we're in with COVID. I'm going to talk about barriers to quality mental health care and how you can overcome many of those barriers, particularly with measurement-based care. We're going to talk about some innovative approaches to complex conditions, specifically substance use disorder and PTSD. I'm going to share with you some McKinsey information for employers related to mental health care for their employees, some specific questions that you can ask your providers to ensure that you're getting quality mental health care. And then we're going to go into the questions, and I encourage you to please put your questions into chat, and then Heather will be asking me those during the Q&A. And as Heather mentioned, we'll come back at the end and I'll give you 10 tips to promote your mental wellness during these challenging times. So let's jump into it. What's the value proposition for quality mental health care? Well, 2 in 5 adult Americans are now suffering from a mental health condition. Just for reference, prior to the pandemic, that was actually 1 in 5. So we've seen a doubling in mental health conditions due to the pandemic. And if you think about it, that's related to the stress, the anxiety, the isolation that many people are feeling today. A 1% increase in mental health treatment results in a $2.4 billion savings in medical costs. There's huge opportunity here to dramatically reduce our rising medical costs. Interesting statistic, someone who has both a physical medical condition and a mental health condition costs 2 to 3 times what that person would cost in medical care if they only had the medical condition. So think for a minute about someone who has diabetes and depression. Because of their depression, they're not checking their blood sugar as often, they're not taking their insulin, and that makes their medical conditions much more severe. Let's talk about addiction for a minute. You've got 14.8 million people who have an alcohol use disorder, 2.1 million who have an opioid use disorder. Now, these are pre-COVID numbers. What we're seeing now post-COVID is a 40 to 60% increase in addictions. Drug overdoses are up from 60 to 70% in Florida alone. And so we're seeing people self-medicating, unfortunately, during the pandemic to alleviate a lot of their stress and tension. Now, you may think that people who are addicted are the homeless people on the street. And in many cases, that is very true. The reason that they're homeless is it started with their addiction. However, 70% of the people who have an addiction are employed. They're your employees, they're your team members, and they are causing lots of issues with medical costs, absenteeism, presenteeism, productivity, including even factors related to accidents, workers' comp, and other issues. And if you really want to look at a bottom line, someone who has opioid use disorder, if it's untreated, it costs $31,000 versus if it's treated, it's $13,578. So huge upside to take care of people, get them in the proper treatment, and reduce your overall costs. Let's talk about the impact of COVID on employee mental health. Our company does assessments of everyone who comes into our program, and we measure the different things that you see on this slide. We have a whole database because of that. So we looked at March through June of 2019 and compared it to March through June of 2020, so pre and post COVID. These were the increases that we saw. 33% in depression, and depression was already the most prevalent condition out there. 88% in PTSD, 39% drugs, 15% in suicidality. The CDC published a report a few months ago that showed in the 18 to 30-year-old age group, the percent of people who have considered suicide is 25%. 1 in 4 in that age group have considered taking their own lives, primarily because of the stress of COVID. So dramatic impact here. Now, employers have seen this issue and they're responding to it. They are finding that, or they are looking for high quality mental health services, substance abuse treatment. They're providing telebehavioral health services that we're going to be talking about. They're doing online resources. So not just requiring people to go to a counselor, but also providing them with apps and other resources. 88%, up from 69%. 65% of employers are training their managers to identify mental health conditions and recommend to people that they get help. And that helps to reduce the stigma dramatically when your manager is saying, hey, can I help you? It looks like you're struggling here. About more than half the employers are actually going to lower or waive the cost for virtual mental health services in 2021. Again, a huge change from what we saw pre-COVID. But one of the interesting things is you're finding employers struggling with accessibility in their networks and trying to find care for their people. There was a SAMHSA report that just came out about a month or so ago. Just the current needs for mental health care, not 2025, not 2030, current needs, we need 4.5 million more mental health care professionals in the United States. And to put that into context, we have 300,000 counselors in the US today. The report said we needed 1.4 million. So you've got a shortage of providers out there, and access to those providers is critically important. And then finally, employers are looking for high-performing networks. They're looking for results, not just send somebody to a program and assume it's going to work. Show me that it actually works. And that gets into metrics-based care that we're going to talk about. I want to address this up front because I frequently get this question when I'm meeting with an employer. They say, I've got EAP. Isn't EAP enough? Well, the answer in short is no, it's not. If that's what you're looking at to provide you with quality mental health care, it's not adequate. EAP programs typically have 1% to 2% utilization. The American Psychological Association says any type of quality mental health program should have a minimum of greater than 5% utilization, and actually 10% or more is preferred. Oftentimes, these programs use phone or text counseling, whereas quality programs want to have that nonverbal communication, face-to-face video or in person. Counselor quality is very variable, whereas in quality programs, the counselors are rigorously selected. You want to match the person to their specific needs. If the person has PTSD, you want to send them to a counselor who is familiar with treating PTSD, and oftentimes that's not the case in an EAP program. You want to have full 1-hour sessions. Typically, the EAP programs may be less than that. You want to have a continuity of care. Once someone establishes a therapeutic alliance with a counselor, you want that to continue. And unfortunately, with many EAP programs, they're limited to 6 sessions, and then you have to switch counselors. Limited scope. Many of these programs can deal with mild to moderate anxiety or depression, but when you get into more severe conditions, they're out of their league. No outcome metrics. You can say, well, how many people had sessions or how many sessions did they have, but were those sessions effective? And then finally, typical EAP programs really have no impact to healthcare costs, whereas quality programs actually have a very positive impact. So let's talk about some of the barriers to quality mental health care. Dr. Doug Nemisek is the medical director for Cigna, a great guy, and he had the phrase, he said, behavioral care is 10 to 20 years behind medical care in terms of access metrics and evidence-based treatment. You know, unfortunately, behavioral care has not caught up with where it should be in terms of providing the quality of care in many cases that's needed. You have limited access. 51% of U.S. counties have no mental health resources. Now, those are primarily in rural areas, but they don't have a psychiatrist, psychologist, mental health counselor. I live in Florida, and there's 67 counties in Florida. 22 of them, of the entire county, has less than 10 mental health professionals, and some of them have 0. So, you know, what we're seeing here is that not only is there a shortage of providers, but they aren't located where people need them to be. You still have stigma and confidentiality issues, fragmented providers with no overall quality measures, a lack of metrics and measurement-based care, and then the shortage that we talked about earlier. Let's talk about video counseling. Now, it's interesting. My company has been doing video counseling only, virtual counseling only, for the past 5 years. Pre-COVID, there were many people who said, well, that's a great idea, but, you know, I don't know, you know, well, we'll see. Obviously, post-COVID, everything shifted online. And so many people are starting to see the benefits of virtual counseling. Optum, which is the behavioral health arm of United Healthcare, has done telebehavioral counseling for a number of years now. And these are some of the results they've seen. 25% reduction in hospitalization rate, lengths of stay, and services. So think about that for a minute in terms of your overall medical costs, a 25% reduction. People are getting in to counselors much faster, and they're missing fewer sessions. Again, what we've seen with my company is a 2.6% no-show rate. Now that compares to 25 to 40+% in traditional in-office counseling. And it just has to do with the convenience and the confidentiality, the ability to have your sessions at home, to do your sessions at work comfortably and without having to drive to a counselor's office. Metrics-based treatment. Again, I talked about one of the barriers being a lack of evidence-based or metrics-based care. This is a pretty amazing statistic. If you use measurement-based care, it results in a 79% or 74% remission rate compared to 29% for the standard rate of care. So you would expect that everyone would use metrics and measurement in their programs. Unfortunately, it's actually fairly rare. And what we do is, as I mentioned earlier, everyone who comes into our program is assessed on multiple conditions. It's 27 questions completed online in 5 minutes. We give that to the counselor before the first session. So they can actually zero in on a diagnosis, validate the results. They discuss the results with the client. They say, look, you know, you have depression at the 85% level. You have PTSD at the 65% level. So they're able to really show the client that they've got a condition that needs to be treated. And then we reassess people as they go through. So typically about every month, every 6 sessions, we will reassess to look for improvement and actually show the client that so they can see, hey, I'm getting better. This is really working for me. Because we do these assessments, we have all this data. And so we asked the University of Central Florida Department of Health Informatics, a researcher from there, to analyze our assessment results and say, what can you determine from this? Now, these are all pre-COVID numbers. We do have some post-COVID information, as I shared, but I thought I'd share the pre-COVID. So interestingly enough, in 22% of the cases, the person actually really didn't have a mental health condition. It was mainly just dealing with daily stress, or we were able to give them some education, some sessions. But in almost 50% of the cases, it was moderate or severe. The most significant, of course, was depression, 57%. Now we're seeing depression at the 80% level for the clients that are coming in. Anxiety, 44%, PTSD, 40%, and bipolar at 13%. The other benefit of doing assessments is you can actually measure improvement. And so using that same database, we said, okay, is what we're doing effective? Does video counseling work? the eHome counselors effective in what they're doing? Does metrics-based care make a difference? And so we looked at people who had a minimum of 10 sessions, and we were actually able to measure and say, for these specific conditions, for example, depression, 79% of the people improved, and you can see the different amounts. Very significant improvements in drug use, and even in suicidality. Suicidality is a very tough topic and very difficult to treat, but 58% of people improved, and those that did improve very significantly. Let's talk about new approaches to behavioral health care. I put this slide in, and it kind of the picture of the Freud, right? You go, you lay down on a couch, and you talk to the counselor. Well, obviously, people don't lay down on couches much anymore. They sit in chairs. But if you really look at it, behavioral health care hasn't changed that much in 50 years. Again, the model up until COVID in particular was you would drive to a counselor's office, wait in the waiting room, have your session, drive back, miss work, miss time, and there really wasn't much support in between your sessions. Well, the new care today is very different. It's virtual, so it's convenient, confidential. What we find clients say the most is, doing it in my own home, I'm able to open up much more than I did when I was in a counselor's office. I don't have all the stress. I don't have to worry about traffic. I don't get there stressed. And so I'm able to be much more comfortable in my session. Assessments that we've talked about, individual and group counseling, and just like we're doing today on this call, you can now do group counseling virtually. And so if you're doing family counseling, it means that everybody doesn't have to be in the same location. Text check-ins, online education. We have an app, a 365-day digital experience app that supports you in between sessions. So you may go to your session every week, but every day you're getting a motivational video and educational video accountability. Psychoeducational sessions. Education's a big part of mental health care. And so doing that in a very structured way is helpful for people. We talked about the family sessions, counselors who actually specialize in your needs. And then something very important we'll talk about for addiction treatment is medication-assisted treatment. So let's talk about traditional substance use disorder treatment. John Kelly is a well-known researcher, professor at Harvard Medical School in the addiction space. And he says, it takes a typical opioid-addicted user 8 years and 4 to 5 treatment attempts to achieve remission for just a single year. Now, many people who have dealt with addiction, opioid addiction, will tell you that's actually on the low side. One of my friends whose sons went through it, went to rehab 15 times before his son was able to maintain sobriety. So we have this, unfortunately, revolving door of inpatient care, and many people in the industry talk about this. You go to an inpatient program, it may be 14, 30, 45, even up to 90 days. You're discharged from it. Because you don't have the same level of support that you had in inpatient care, remember you got 24-hour-a-day care, you're not under stress, all your meals are provided, you're in a great setting. Now you're back in your old environment that caused you to become addicted in the first place. And now you're facing all those stresses, family stresses, work stress, everything else. And so, frankly, many people relapse, typically within the first month after discharge. They relapse, and today, because you have something called fentanyl-laced heroin, a very powerful drug, fentanyl, which is put into heroin and makes it much more dangerous, many of these people overdose and die. But if they're lucky enough to live, they end up in the emergency room and then have to be taken care of. They go back into inpatient care. And once again, you're just on this cycle, revolving door. What we're finding, too, is that only 26% of people actually even get treatment. And in 29% of those cases, the treatment is considered minimally adequate. The relapse rate, 6-month relapse rate, is more than 50%. more than 50% will relapse within 6 months. And then the end result are ER visits, deaths, and unfortunately and very sadly, 100 babies born with neonatal abstinence syndrome every day. So a huge impact on our society. We've got to look at new ways of treating substance use disorder. In substance use disorder, you want to maintain or achieve long-term chemical and emotional sobriety. When you take drugs or you drink alcohol, it actually affects your brain chemistry. And the first thing you've got to do is to get that brain chemistry back in order. That's what causes your cravings. That's what causes your withdrawals. Medication-assisted treatment helps you. There are medications that help to stop the withdrawal, stop the cravings, and help your brain heal. The primary one for opioid use disorder is something called buprenorphine. And when you're on buprenorphine, once again, you don't have the effects of the drugs and your brain is allowed to heal. For alcohol use, there's drugs called Vivitrol and Antabuse. So these are incredibly helpful, but even more importantly, they increase the survival rate. Now, think about it for a minute. If it were a cancer drug, and we said, if you take this drug, it'll increase your survival rate for cancer by 10%, everybody would be on it. Well, here are drugs that will increase your survival rate by 50%, and yet only about 29% of the addiction treatment programs out there today actually use them. So our position is everyone who has an opioid addiction should be on medication for it to help heal their brain. But then it's not just enough to heal the brain and get the chemical sobriety. Addiction is either caused by a mental health condition or it actually causes a mental health condition. So you can get addicted just by taking legally prescribed opioids that your doctor may give you. And in the fact of becoming addicted, you actually end up anxious, depressed, you get PTSD. And so once again, in one way or another, the person who's addicted has an underlying mental health condition that has to be treated. And that's done through therapy, cognitive behavioral therapy. If that behavioral therapy is done with video, it has twice the completion rate than if it's done in person, 80% versus 41%. Hazleton Betty Ford is a pretty famous addiction treatment center. They published some research a couple months ago. They had looked at in-person care, in-person plus virtual care, and virtual care alone. And pretty shockingly, they came to the conclusion that virtual care alone is as effective as in-person care. And in fact, the people in virtual care completed, more of them were likely to complete treatment and more of them had more sessions. So it's shocking because if you think about it, Hazleton Betty Ford has a huge base of residential facilities. But they said virtual care is as effective. You want a program that gives an extended period of care, 6 months of care at a minimum. And that's one of the issues with current treatment. It's, as I said, 14 to 30 to 90 days. Well, that's not long enough for the brain to chemically heal and for you to treat the underlying issues. You need a 6-month program. And then, once again, delivered virtually. Let's talk about PTSD for a minute. Again, many people believe that PTSD is just an issue for veterans, and particularly Iraq and Afghanistan veterans, because there's been a lot of publicity about that. We are a major partner with Wounded Warrior Project. We treat a number of warriors with severe PTSD, but it is not just a veteran issue. And as you see some of these statistics, you see first responders, you see healthcare professionals, you see corrections officers, but this one statistic is, again, very startling. That CDC report that I referenced earlier found that in that 18 to 30-year-old age category, 32%, a third of the people in that category have PTSD. So, one message I want you to take away from this is not just specific populations. This is your employees. This is a lot of people that you're working with who have gotten PTSD because of COVID and its psychological impact. For traditional care for PTSD, there really aren't that many great programs for it. And many of the programs, once again, are veteran-based or first responder-based, but they tend to be residential programs where you have to go away for anywhere from 2 weeks to a month. You spend $30,000 to $50,000 or more. With virtual care, you can actually, and our program is less than $5,000 for 12 weeks of care. And it's highly effective. The person doesn't need to leave their home. They can do it completely confidentially. So these are just examples of how new approaches can actually be much less expensive and much more effective than what we're doing today. So I mentioned earlier about McKinsey, a McKinsey report, and I would highly recommend that everyone on this call take a look at this report. The source is there on the slide, and you'll be able to get that when the slides are put out. But I thought, their overall, one of their statements, the pandemic has made painfully clear that our collective emotional health is in jeopardy, and many employers are scrambling to meet burgeoning demands. They give specific information here, 6 ways to ensure that mental health benefits serve a company and its people. So as HR professionals, these are some things you can actually look at and check off and say, are we meeting these requirements? The first is measurement. We've talked a lot about that this afternoon, but once again, if you talk to your insurance carrier, whoever is providing behavioral health, and they can't provide metrics, they can't provide measurement, you should probably go look for somebody else, because this is a requirement now. They need to be able to show what they're doing is effective. Make it a transparent priority. Talk about it. Let people know that you care about their mental health and you want to help them. Hold leaders accountable for making progress. We talked earlier about training leaders on what to look for and how to help people with a mental health issue. Well, hold them accountable as well for that. Explore a range of new services, including online interventions. We've talked about these new approaches to care and how you can approach things differently, much more effectively, with what I would say is a combination of the human element, which is the counseling side, combined with technology. Okay, some people ask me and say, well, what about just giving people apps? Well, there's over 10,000 mental health apps out there today, and most of them don't really have any kind of proven effectiveness. But what you can do, as we've discussed, is combine an app with the in-person, with the counseling done virtually, and get a very strong program out of it. So our recommendation is to both the human counseling and some type of app for support in between your sessions. Work closely with your health benefits administrator, ensure adequate behavioral health coverage. I'll talk about that in the next slide, what you should specifically be looking for with that. And then consider on-site mental health services. Now, obviously, that's when we're back on-site, but it can be helpful for people to have somewhere to go where they can get help. And it may not be specifically an on-site counselor, but it may be someone who can help direct them to where they can get the counseling help and the mental health care that they need. One of the things noted in the article is Harvard Business Review noted that $4 is returned to the economy for every dollar spent caring for people with mental health issues. So, a huge societal issue, one that is frankly going to last much longer than the physical impact of the pandemic. We're going to see the psychological impact go on for a very long time, and the smart employers are getting prepared for that. So, again, a question I've gotten in the past, well, Brad, how do I know what a quality program looks like? Can you give me some specific questions to ask, or what should I be looking for? So in concert with the Florida Alliance for Healthcare Value, we put together the Employer Guide to Identifying High-Value Telebehavioral Health Care. And this is going to be available after our webinar, along with the slides. This is a PDF that will be there. And so this will really help to guide you to say, okay, when I'm talking to my carrier, when I'm talking to my broker, how do I ask the right questions and what answers do I look for? So, I've highlighted some of these. Quality carriers should minimize both medical and mental health costs. What we've seen in the past is that many carriers will separate out and say, here's the medical cost, here's the mental health costs, here's the pharmacy costs. And unfortunately, what can happen in a situation like that is that each of those areas tries to get the lowest, we want the lowest medical costs, we want the lowest behavioral costs, lowest pharmacy costs, but in preferring one over the other, you actually raise one. So you say, okay, hey, wow, these behavioral health costs look really cheap. Well, guess what? Your medical costs are paying for it because you aren't treating the underlying behavioral health conditions. So you want to look at the entire picture. Telebehavioral health by video with quality providers. As I say, we've been in this business for 5 years. We've seen a lot of the people out there. There's some great providers. There's some not so great providers. And you really want to find a quality provider that rigorously selects their counselors, that uses metrics-based care, that does full sessions, matches people appropriately. So just make sure you're getting a quality provider. Short time to appointment. This is very important in mental health care. So when somebody says they need help, you have a very short window to help them. And if you aren't able to meet that window, typically they're not going to come back, or they're not going to come back for a long time. So somebody says, I'm afraid I'm addicted, I may have an issue. If you say, well, we'll get you in with somebody 2 weeks from now, okay, that's not going to do it. It's got to be pretty immediate. And typically you should get somebody in at a maximum of 5 days. We get people in within 48 to 72 hours. And that's from the initial intake, the assessment, in with a counselor by video. And that's what you should be searching for. We talked about measurement-based care. Removal of barriers for accessing behavioral care, particularly for addiction treatment. Most of the carriers today are better on this, but there's still some out there who put up barriers to care. And what I mean by that is prior authorization requirements. If you want to go on this particular, drug for addiction treatment, you've got to get, special authorizations. And you've got to make it easy for people, because these are people who are already struggling with a mental health condition, right? So when you make it difficult for them to get care, you're just going to turn them off to care. You're going to add to their stress, their anxiety, and so you want to make it easy for them. We talked about medication-assisted treatment, but you should ask specifically and say, what percentage of the people in your addiction treatment programs get medication? And it should be a high percent. And if it's not, then the question is, why aren't they? Are you not promoting it? Are you making it difficult for them to get it? Coordinated primary and behavioral care with behavioral care screenings. When you go to see your PCP, part of the evaluation that he or she does should include a behavioral health screening. And unfortunately, many doctors are not doing this. I recently went for my annual checkup and there was no screening. And given the importance of this for a person's overall physical health, they should be screened for mental health. And you can ask your carriers and say, what percentage of people are getting screened for both when they go for their annual checkups? And then finally, just like in your business, you want to have high customer satisfaction, low no-show, and high completion rates. So, those are things to ask for. Do people stay in treatment? Do they complete their treatment? Do they get better? And so with that, we're going to switch over to questions for a few minutes. And I think, Heather, you are going to be looking in the chat room, the Q&A room, and seeing what kind of questions and ask me.
Yes, thank you so much, Brad. Excellent information. We do have a few questions from the attendees. The first one is, can you train managers to assist employees with mental health issues? As an employer, we can't diagnose employees as it is a lead to legal allegations and violates the employee HIPAA rights.
Great question. Yes, there are absolutely limits on what a manager should do or can do. There's a great program called Mental First Aid that many companies out there are using to train their managers. And it's not to say, well, you need to diagnose this person, you need to say whether they've got depression or PTSD or whatever it is. It just is identifying how you can appropriately ask the person questions, what things you should be looking for, and not go over the boundaries of, HIPAA and things like that. So I would highly recommend that program, Mental First Aid, for your people, and you're seeing, a lot of companies doing that as part of the required training for managers these days. I'm sorry, Heather, I can't hear you. Did I lose something?
My apologies about that. My apologies. Another question from the audience. Is the technology reliable? Recently experienced a platform that therapists used froze, didn't work properly, etc. This was stressful.
Great question. Yeah, once again, as a lot of companies have jumped into this space, they're doing it with some platforms that aren't reliable. And so that's, probably in my previous slide, I should have added that to make sure that the platform the company is using, number one, is HIPAA compliant. One thing the government did, because of COVID, they allowed counselors and even doctors to use things like FaceTime or Skype, which are not HIPAA compliant, to talk to their clients and patients. So, from day one, in our company at least, we said we're only going to be fully HIPAA compliant. We want people to have the confidence, the security that what they're sharing is completely confidential. And so quality providers have invested the time and money to provide quality platforms and to make sure that you don't have that additional stress, from the system not working and that if there are any issues, there's a great, client care team, tech support behind it that can help resolve that. But yeah, a very important question. But let me just say, because I've heard some people kind of say, well, because of some of these issues, we shouldn't have virtual care. You know what? If you were going to a counselor in person, you'd have traffic jams, you'd have your car breakdown, you'd have all kinds of other potential issues that could have prevented your session from happening. So I'm not excusing any kind of technological issue, but just to be fair, you want to put a head-to-head comparison there. And but by choosing a provider that has the quality system, hopefully that'll be minimized. These are great questions.
Yes, they are. We have a few more coming in too. This next one, I work for a small firm under 100 with significant financial resources. Would an employee survey gauging the need for more robust mental health services be a logical step in the assessment process?
Absolutely. And, you mentioned, Heather, that I worked for Disney, and one of the things we did at Disney was to extensively survey not only our guests, but also our employees, as they're called at Disney, our cast members. And the only way to really find out if you're meeting their needs is to ask them and to say, hey, have you had a need for mental health care? Have you been able to get a counselor within a reasonable amount of time? Has that counselor helped you? Do you think it was quality? Were you given any metrics to show the benefit? And, you can very easily create a survey, just a short survey that asks some of those basic questions and really find out, how are we doing in this area? And how easy is it for people to get the care that they're looking for? Easy for people, you've got to highlight it. We take care of, for example, self-insured employers. And, one of the things we say is you can't just send out one email and say, hey, eHome Counseling Group is now taking care of you. It's got to be multiple messages to get people to take action. And so, but a great start on that is to do that survey and find out where you stand today.
Great, thank you. Another question we have, can any of these on-site services be underwritten under our existing healthcare or WC programs?
Yes, absolutely. And you know, I think as HR professionals, kind of getting back to the questions that I was asking, you're already, in many cases, paying a lot of money for these services. I mean, through your healthcare insurance company, maybe through an EAP program, maybe through workers' comp. And so you should be demanding of it and say, show me that I'm getting the value for the money that I'm investing here, and ask those tough questions. And if you're not given adequate answers, or if they basically kind of, yeah, well, don't worry about it, they pat you on the head and say, you know, it's our area, we'll take care of it, then go find somebody who can provide the care that your people need. But yeah, I mean, make sure you know what you're paying for today, and you know, if it's not adequate for your people, get something different. So, you know, let me talk about workers' comp for a minute, because many people, and I've seen this happen, where they look at workers' comp and they don't look at the mental health care part of workers' comp. And I shared with you a statistic early on of, you know, the huge amount, 60% of the cost of some claims is behavioral health care. We had an instance where a person had injured their back, and we were talking to workers' comp people, and they said, yeah, they've been in counseling for 6 years. And we're like, what? I mean, you know, but it's because employers questions to their workers' comp providers and saying, what are you doing on the mental health care? Every person who has a workers' comp claim should be assessed immediately for their behavioral health, and to identify if they've got an issue, because it will only make the medical costs much higher if that issue is not identified and not taken care of up front. So yeah, be very demanding of your providers in this area.
Great, thank you. Another question, video-based sessions, are they recorded? How secure is the recording, and can it be protected in 2021?
Absolutely not recorded. No sessions recorded, and it is, you know, I know many of you are doing video now and Zoom and all that, and you hit the button to record. No sessions are recorded. None of our sessions are recorded. And in fact, as we were talking about kind of platforms and systems before, the quality systems will not allow you to record the session. So for HIPAA reasons. And so, so yes, that should not be anybody's concern. No sessions recorded. It's completely confidential. And then, you know, afterwards, the counselor will do patient notes, just like your doctor would do after any kind of medical exam. But those are also all completely HIPAA compliant, stored in HIPAA compliant systems under very strict rules. So confidentiality is absolutely crucial. And it's crucial in that therapeutic alliance, because you have to feel that what you're sharing with your counselor is just between you and your counselor, and no one else has access to it.
Perfect. And along those lines as well, somebody had asked, is Zoom one of those platforms that are reliable?
There is a HIPAA compliant version of Zoom now that they actually created kind of post-pandemic. So, but you have to make sure you're using the HIPAA compliant version, and not just a typical, you know, Zoom, whatever it is, $99 subscription or whatever. So I can tell you the HIPAA compliant version is more expensive and more difficult to set up, but any quality provider should be using only a HIPAA compliant version of any type of video conferencing or counseling system they're using.
Perfect. Another question we have, apart from manager training, what more can HR teams do in-house to help support overall mental health with their employees?
There's lots of things. I was fortunate to be on a call with the leader at American Express, American Express is one of the just premier companies when it comes to mental health care for their employees. And so they do a number of different things. I can't go into all the detail here, but you may want to look it up. But, for example, they do group sessions, and they, by video, where they have people, in these groups. They're facilitated groups, moderated groups. And, frankly, they thought, is anybody going to show up for this? And they ended up having like 80 people, for these, and having to do more and more sessions. And so, and they were, surprised. And again, these are more, they aren't necessarily therapy sessions, but it's more kind of discussion sessions and moderated sessions. I'd say the biggest thing is really to use your communication techniques. So, you may have an employee portal, you may be sending regular emails, and always just include a section on mental health and say, are you struggling with this? Here's some things that can help. Again, I'm going to come back at the end here to some tips to help people, but always do a section on that and then say, do you want to get help? Here's where to go to get help, and make it easy for people. The other thing is that, and we've done this with employers, the ability for someone to confidentially do an assessment of their mental health and find out if they've got an issue. So in a situation like that, we set it up, you do the assessment, what we call our M3 assessment, 27 questions, 5 minutes, and only you get the results. We don't get it, the employer doesn't get it, only the employee gets it. And from there, they can see if they've got an issue, and if they do, it says, here's where to go to get help. But they don't have to kind of question, do I need help? They can actually see quantitatively. So there's a bunch of different ways that you can help your employees and to be focused on this. And again, there's a lot of great companies out there that are doing really good work. I would look at that McKinsey report as well, because I just hit some of the highlights of it, but they've got some more detail on there of what you as an employer can do to help your employees.
Great, thank you. Another question we have, can you recommend anything to help our workforce with Zoom fatigue? This was having an impact on our workforce.
Yeah, absolutely. And once again, some of the tips and tricks I'll give you in a minute will help with that. I'll tell you, I've been a Zoom user for 6 years. Our company is actually virtual. So long before COVID, everything we did was virtual. We have people all over the country. So this was not a new thing for us. Here's the one suggestion I would give everybody being kind of a power user. Turn off the self-view. There's an option that says hide self-view, and if you're not looking at yourself all the time, it will really help you in terms of preventing Zoom fatigue. But beyond that, obviously taking breaks, walking around, exercising, being in nature, there's lots of different things. But for those of us on the call here, I would tell you the number one thing, turn off the self-view, and you'll find it's much, much less stressful.
That's a great point. I'll definitely keep that in mind. Another question we have is, can you provide a website to the mental first aid training class mentioned? When Googled, lots of different options came up by various providers.
I'd have to look it up. I don't have it at the tip of my tongue, but we can certainly in the follow-up on the Q&A find a good site for you, and I can help you with that.
Great. And then somebody actually had asked, where could they get those 27 questions that you had just mentioned?
Oh, that's part of our assessment. Yeah, that's part of the assessment that we do for people. So it's actually you essentially answer the questions, and then that gives you your mental health condition. But it has to be scored and things like that. So it's not just kind of asking questions. It's a process you go through, and you get sent the link to the assessment, and then you do it. So, but I'd be happy to talk to whoever submitted that question separately and kind of take you through it if you like.
Great. And the last question that we have so far, isn't party still a part of employers' health insurance providing the same number of visits at the same cost as seeing your specialist?
I'm sorry, could you ask that again, Heather? You broke up for a minute.
Certainly. Sorry about that. Isn't parity still a part of employer health insurance, providing the same number of visits at the same cost as seeing your specialist?
Are you talking about parity?
Yes, I apologize if I misspoke that.
Yeah, okay, got it, I'm sorry. Yeah, let's talk about parity for a minute. So there's two types of parity. One is the Mental Health Act that requires insurers to provide parity in terms of mental health care that matches medical care, okay? And so what that's talking about is that you can't put more restrictions on mental health care than you do on medical care. And frankly, the insurance company is very mixed on doing this. And as I mentioned before, things like prior authorizations for addiction treatment, other things really do not reflect mental health parity. It's interesting, many insurers say, well, we'll let you have 12 sessions, and then if you want more, they have to file a claim to do more. And if you have cancer treatment, they don't say, well, you can only go to your cancer doctor 12 times, right? But for some reason, behavioral health, they think that's appropriate. So that's part of that. Look at what restrictions your insurer has. But the second part is payment parity. And this came up through COVID, where, again, some insurers were saying, well, we're going to pay less for a session that's done virtually than we will one done in person. And if you think about it for a minute, that is a very poor decision on many fronts, but in particular from the health equity front, because it really says if you have a counselor who sets up their office in an expensive part of town and the people can come visit them, they get paid more than the counselor who's doing a virtual session with somebody in a poorer part of town. And that's just not right. So you want to look for mental health parity, and you want to look for payment parity with your insurance company to make sure that they're getting quality providers and not putting people at a disadvantage who are trying to get access to care. So great. Heather, why don't we jump into the last slide and we can share some of the tips for everybody.
Great, thank you.
Perfect. So here are 10 tips to combat stress and isolation. And I pulled these from various sources. You can see there at the bottom. But, some of these just are common sense, but things that may get left at the side, with what's going on with COVID. First, stay connected with your social networks. Isolation causes tremendous stress on the human body and psyche. We aren't meant to live in isolation. We're meant to be in groups. And so it's very important. It's easy to say, I'm just going to stay in my house. I'm not going to, interact with people. But as much as you can, stay connected. And that doesn't necessarily mean you have to physically go there, but whether it's phone calls or text messages or, video calls, however you stay, but stay in touch with people. Get a personal routine and stick to it. One of the things that you can easily drop into is, well, I'm not going into the office. I don't have to be there at a particular time. I don't have a commute that I have to do. And so we end up with our routines all shifting. But if you have a good routine, I exercise every morning. I go to bed at the same time. I wake up at the same time. Those are all very important to reducing your personal stress in these challenging times. Stick with credible sources of medical information. There's so much stuff out there, and a lot of it is not good. And so, find a good source, whether it's, the CDC, Mayo Clinic, whoever it is, but don't just go with what you read on Facebook or some of these other things. I think number 4 is really critical. The best way to help yourself is to help other people. And to do what you can do, whether it's your fellow team members, whether it's in your community, it may be financial contributions, it may be time and other contributions, but help other people, and you're going to feel so much better when you do that. and so many people are in need right now. Do things that are pleasurable to you. So, if you like to read books, or if you like to watch a movie or whatever, feel free to do that. Don't say to yourself, well, I'm just going to shut everything off and I'm going to feel guilty if I do something pleasurable. Now, number 6, though, is if that pleasurable thing is drinking, smoking, or taking drugs, don't do that, okay? Don't self-medicate. And unfortunately, what we've seen in this is, alcohol sales up 100%. As we talked about, drug use, other things. Don't use unhelpful coping strategies to deal with this. If you're tempted to go down that route, do something else that's much more healthy for you. One of the key things is we have to accept uncertainty and anxiety as just part of life, okay? So, you can be anxious about when am I going to get the vaccine? You can be anxious, if I go out and somebody coughs on me, am I going to get COVID? But, we just have to understand that we can't control everything. And yes, you should do everything you can to stay well. You should follow all the guidelines, wear a mask, or these days wear 2 masks, and socially distant. But at the end of the day, we have to accept what we can and what we cannot control, and accept that uncertainty and anxiety is just part of life. Humans are very resilient. And, you've heard about the 1918 flu. We came back from that, and, it was the roaring 20s. And so, humans figure it out. We're going to get over this. So, a year from now, things will be better, and keep that in mind to kind of keep your mental state strong. I'm a big believer on number 9, spend time in nature, okay? Get out, take a walk. I'm fortunate that I live in Orlando, Florida, so I went out today and on my deck and had lunch, and just to get a break from the 4 walls of my office. But, go for a walk, go for a bike ride, appreciate and be mindful as you're doing it. Look around, look at the birds, look at the trees, understand how amazing nature is. And this is a unique time for us to kind of slow down and notice some of the things that we may not have noticed in the past. Consider yoga, meditation, controlled breathing, and spiritual practices like prayer. This is a good time if you've thought about doing that. Meditation, there's lots of meditation apps. Controlled breathing is incredible. Highly recommend that. They're even for your Apple Watch or other things, it'll pop up and tell you to breathe and give you the sequence of doing it. So try some of those things, just all to reduce your stress. And then the last thing is, you can't take care of other people until you take care of yourself. And so if you feel that you are struggling, get help. There's so many people that I talk to who say, I waited, I hesitated, I should have gotten help a lot earlier, and now it's made such a huge difference in my life and in the life of my family. So if you're struggling, get help, and I think you're going to find tremendous benefit from that. And then frankly, you can tell others about your experience. So with that, I just want to thank all of you for your time this afternoon. Wonderful questions, great attention. I'm here to help. My team is here to help in any way that we can. I got in this business to help people. And so, I think that's part of my Disney background or whatever, but whatever we can do to help you or your company, please feel free to reach out in any way. And we're going to all get through this. It's going to still be challenging, but the number one thing is to preserve your physical and your mental health, because if you don't have that, everything else is minor in comparison. And thank you so much, Heather, for setting all this up. It's been great.
Oh, not a problem. Thank you so much, Brad. Such insightful and important information that we all need to know. Thank you.
Thank you.